Good morning.
It's good to have you in the studio.
It's good to be here.
Thank you very much. We want to, of course, say thank you very much for giving us the time to join us in the studio this morning. We are aware of your busy schedule, but yet you decided to join us. Thank you very much.
It's my pleasure.
Now, we're talking about birth preparedness. Let's start from the foundation, right, for the benefit of Nigerians and the good people of Ikorodu who can hear you this morning. How best can you help us understand when we say birth preparedness? What does that mean?
Okay, so the topic is actually birth preparedness and complication readiness.
Great.
Okay, so it's the steps that we take to ensure a safe delivery, live mother, live baby at the end of our 9 months journey.
So it begins from while the baby is in the womb up until the time of delivery.
From the inception of pregnancy up until delivery.
Wow. Okay. Beautiful. Now, is this a thing that concerns majorly? Maybe like they always say, oh, if you're having your first child, you are the one that should worry more about all of this antenatal and all that. There's this ideology, I don't know if you've heard, you should have heard that, oh, if you've had your second child, you don't need all those antenatal, you don't need, for instance, this child preparedness and all that. You already have the experience. You being a medical practitioner that sure knows your onions well, what would you say to that situation for people that believe that after your first child, you don't need all those things anymore?
Okay, so I would say that's a fallacy because every pregnancy is a new experience. You don't treat any pregnancy the same, even if it's carried by the same person. So every pregnancy should be treated as an entity on its own. So we have something we call under experience and over experience.
Under experience and over experience. Beautiful.
So usually we have under experience is first time moms and over experience with people that have delivered before. And that's where people go into trouble.
That's where they go into trouble. I'd really like for us this morning to look at some of the troubles, like you have said, the issues around birth preparedness and some other challenges that mothers go through, right? But I want to ask now, at what stage, medically, at what stage do you think or do you subscribe to that this is when you should start getting ready, this is when you should start preparing? When we talk about pregnancy, it's from day 1 up until 9 months and all of that. At what stage do a mother, a lady, a female needs to start preparing medically?
From the day she finds out she's pregnant.
Wow. From the very first day she finds out she's pregnant.
She's pregnant.
Oh, it's not a thing that, when we start seeing that your tummy is getting bigger, that is when you should start coming.
No.
Okay, so from immediately from day one. Let's talk about some of the things that, as a medical practitioner, some of the things women should start preparing for. Let's get the conversation.
Okay, so sorry, did I say from day one? I'll say from before you even get pregnant.
Wow.
It's a journey that should start before you even get pregnant. And that's why we have something we call preconceptional care. Yes. Where you get your body ready, your family is ready, everybody is ready for the arrival of this little human. Okay, so there are some vitamins you should start using before you get pregnant. When you find out you're pregnant, you continue. If you have conditions, underlying conditions, you should make sure everything is in place and fine, like hypertension, diabetes, sickle cell. You should make sure everything is fine with you before you get pregnant. And then even as soon as you find out you're pregnant, you continue to take care of yourself, continue to put your house in order. It's not just a journey for just the mother. So it involves the entire family, the husband, the other siblings, every member of the family. Some people, even their spiritual leaders, yes, are also involved in this journey of 9 months.
So you've heard that from our medical practitioner this morning. It is even before the day one, right? Now, I want us to talk about, some of the concerns that mothers go through, right? When you talk about child preparedness, I'm getting ready to have a child, and then they now tell you that, okay, maybe from around that 6 months is when you should start doing this and when you should start doing that. Let's talk about when the baby is now in the womb. What are some of the things you as a doctor will tell a mother to do? What are some of those things they should prepare for?
Okay, so as soon as the baby is in the womb, it's very important for you to first find a good place for where you would register for antenatal care. So that involves somewhere that has midwives, that has doctors, a place where you can deliver either vaginally or by cesarean section, depending on the need. A place where they can take care of you, they can counsel you on all the complications associated with pregnancy, and they can prepare your mind. A place where you can get lectures, where your medications can be prescribed, where everything is in check. Then also you need to, apart from getting your body ready, finances is very important when you're preparing for a baby. So you need to make sure that your finances are available. If it's for you to start saving from day one up until delivery, you make sure that your husband is in tune with everything that is going on, because you need as much support as possible as well. Then also, spiritually, definitely, you need to put your house in order. Then your mind should be open. Because, like I said earlier, that every pregnancy is a different journey. You may have had a vaginal delivery before, and then this pregnancy, for whatever reason, you need a cesarean section. So your mind should be open to the different ways in which you could deliver. And then for every complication that could also accompany. Yorubas greet women that just have children. They tell them ekwe womo. And that's because if you look at it in depth, they understand the dangers associated with childbirth.
And for scaling through, you should be congratulated.
Yes, you should be congratulated. So you need to prepare yourself too for those complications. Nobody prays for anything bad to happen. But then, yes, complications can arise. So we need to be ready.
Some listening right now will just feel like, oh, it's because she's a doctor, that's why she's saying what she's saying. Oh, my forefathers, they never did all of these things, and we used to put to bed safe and sound. What are some of those things you can use to convince people listening right now that it is as important as any other thing when you talk about birth preparedness? Why is it so important medically?
So, not just medically. You said our forefathers didn't do birth preparedness,
Yes.
but actually they did.
Oh, really?
Not just in a formal way,
Oh, okay.
but all those elewe or more traditional
that's
birth
also
attendants.
a means of
They're
preparing.
also, yes, it's a means of preparing for birth as well.
True.
So yes. So you need to put everything in. Like I said, the topic is birth preparedness and complication readiness.
Yes.
So majorly the birth preparedness is so that you can have a safe pregnancy, safe delivery, live mother, live baby, and that so that things don't catch you by surprise. So if you are prepared for the birth, you already know, okay, this can happen, this can happen, this can happen. You put measures in place. It's not just for the mother and for the father, like I said earlier. Every other member of the family is also affected. For instance, if you have a mother that is coming to deliver her third baby, she definitely has 2 other children at home.
Exactly.
Okay. So she needs to prepare, who is going to take care of these children for me when I'm in labor? Where will they stay? Your security at your estate gate is also important, because if you fall into labor in the middle of the night, your security needs to know that, oh, I need to open the gate for this person.
There is a pregnant woman in
There
this
is a
estate.
pregnant woman in this estate that will deliver soon, and I'll need to open the gate for her so that we don't have someone delivering at home. So all those things, they seem minute, but they are very, very important in achieving a successful pregnancy and delivery.
We're still having this conversation here in the studio, and you've heard from our medical practitioner the importance of birth preparedness. It goes beyond just the father and the mother. The children have a role to play. The society have a role to play. Where you stay also matters a lot. And before we even talk about some of the risk factors, earlier you mentioned that a woman might go through the vaginal delivery, or maybe the cesarean section, the CS, commonly called the CS. Let's talk about the CS now. It's good you're in the studio here. There is an ideology that, if it is CS, then that means there are complications. Help us understand, doctor. When CS occurs, is it that in all cases is because there is issue, or there are issues, or maybe the woman cannot put to bed by herself? What's the situation with CS? Does it always have to be when we hear CS, that means there is problem?
Okay, so it doesn't always mean that when you hear CS, there's always a problem.
But you know there is this fear with the word CS, cesarean section.
In our environment, I would say that it's a myth that any woman that puts to bed by CS is not strong enough to be
she's a lazy woman.
She's a lazy woman, which is not the case. At times, the CS is not even because of the mother, it's because of the baby. Okay, so it can either be to save the mother or to save the baby. And maybe not even to save, but as an intervention, just to be sure that nothing happens to either the mother or the baby during delivery. So it doesn't mean there's a problem. It's to prevent a problem from happening.
Can a woman decide to say, regardless of her knowing whether she's capable or not, can she decide to say, I want to have my baby through CS?
Oh, definitely.
Or it has to be a doctor that will look and say, with the look of things, you cannot deliver by yourself. You need to go through CS. How does it work?
Okay, so definitely the woman has the right. She has the right to her body.
Okay.
And she has the right to decide how she wants to deliver. So yes, a woman can decide, I'm not interested in going through the pains of labor. I want to have a cesarean section. So we call that maternal request.
Maternal request.
Yes, and it's very much allowed.
And does the man have a role to play in that, or his decision does not matter? Because at least he's the man, he should say, oh, yes, go ahead. Do you seek permission from the husband or just majorly the woman?
Okay, so majorly it's the woman, but most times we want the woman and her husband to come to a conclusion, to agree that, okay, yes, this is what we want. But if peradventure the woman wants it, the husband does not want it, we follow what the woman wants. And of course, she's going to sign to give consent for us to go ahead.
So it is safe for a woman to go through the cesarean section. It's not a death sentence like we usually, when we hear. For me, I know that, oh, CS, something is wrong. That's what we used to believe. But thank you for that clarification. Now let's talk about another very important question that I believe that a lot of Nigerians would also want to learn from, right? Which is antenatal, right? Antenatal, sometimes we hear that, oh, that happens 6 weeks to the time of your delivery, 3 months to the time of your delivery. What's the ideal way, ma? When we talk about antenatal, when should a pregnant woman begin antenatal? What does antenatal look like?
Okay, so ideally, a pregnant woman should begin antenatal as soon as she knows she's pregnant. And that's only because, so that you have somebody that is experienced that can walk you through that journey of pregnancy. Okay, so the person it's either done by a skilled nurse, midwife, or a doctor. Okay, so they walk you through your pregnancy journey. They make sure you're fine, your baby is fine. We look at so many parameters about the mother. We look at her blood pressure, look at her genotype, look at all her viral markers, that's the HIV, hepatitis B.
Yes.
We look at her blood group. If there's any problem, we allow the mother know and how we can solve that problem. Blood pressure, her blood sugar as well, very important, because we know that all these things have a role to play in the kind of baby that she's going to deliver. Okay, so along the line, apart from looking at the mother, we look at the baby too. At every antenatal visit, we check the heartbeat of the baby, we check the position of the baby. That one is more important towards the end of pregnancy when the baby is in its fixed position. So we check the position of the baby because that too can determine the mode of delivery of the mother herself. Then we make sure that the baby's heartbeat is there all through pregnancy till the end. And then it's at that antenatal too that we begin to have discussions about delivery, the delivery options, why this, why that, why not this, why not that. And yeah, basically.
I asked that question because many a times when we hear antenatal or we see women at different hospitals for antenatal, we see that they are always very heavy. But now you are saying that, antenatal begins from the day you are pregnant. I don't think I've seen any woman that has a flat stomach. Definitely the first 3 months, she's not looking so heavy. I don't think I've seen that. Usually, I think it's usually they come around when they are 6 months or 7 months and all that. But now you have said that antenatal begins like immediately. But however, having said that, can we talk about some signs women should look out for? You would agree with me that there are cases of a woman who will put to bed and unfortunately she lost the baby, right? There must have been 1 or 2 signs that maybe she didn't take cognizance of, she was not aware of. Now, being a medical practitioner and the essence of you being here is to create awareness, right? Can you help Nigerians understand what are the signs a pregnant woman should look out for, that when you start seeing this, when you start feeling this way, please come down to the hospital? I don't know if that question is clear.
Very clear.
Thank you.
Okay, so some of the signs, one of the major signs that we ask women to pay attention to is the movement of the baby.
The movement of the baby.
The movement of the baby. And that's why every antenatal clinic will ask you, is your baby moving well? So we expect, and that question can only be answered by the person carrying the pregnancy.
True.
Okay, so you should pay attention to the pattern of your baby's movement, how frequent the baby moves, so that when there's a problem, you will know. If you notice your baby has not moved in 1 hour, 2 hours, you should raise an alarm. There may be a problem. Then also, if you're having any form of abdominal pain, severe or not, you should also pay attention to that, especially when you're not close to delivery. Even when you're close to delivery, the labor pain has a characteristic pattern. It will tell you that it's on and off, it will hold you, leave you for a while. But if the pain is persistent, it's not stopping at all, then it may be a sign of a problem, especially in women that have had cesarean sections in the past. Any woman that is bleeding during pregnancy, there is something definitely wrong, because you're not expected to bleed at all during pregnancy.
During pregnancy?
During pregnancy.
That happens?
Yes, it does.
Wow, okay.
So you're not expected to bleed at all during pregnancy. If you begin to see water That one too is also, it can be a danger sign, it can be a sign of labor.
Mm.
Then also any form of illness in the mother, you're feeling sick, you're running temperature, you feel weak, you feel dizzy, you feel you can't stand. All those are also signs you need to look out for, because they may just be pointers to a problem.
Let's talk about finance. You know, while you talked about the importance of birth preparedness the other time, you talked about the environment, the family, you also talked about money, being financially ready. Is this to say that child delivery is one expensive or a big deal right now? Let's take it from the angle of General Hospital Ikorodu, where you are. Some people will decide to stay back at home. It's good you even mentioned the Elewe or more thing by yourself the other time. Some will say, I cannot afford the hospital. Let me just go down to the local ones. And then, how affordable is it financially? Being realistic, Nigerians can hear you right now. How affordable is it to deliver a child in our society today in a general hospital?
Okay, so I can't put numbers to the
Definitely not,
exact,
yes.
definitely, but
Yes.
I would say it's quite affordable, especially compared to private hospitals, compared to other centers. It's quite, maybe not, I can't say it's cheap, but it's quite affordable.
It's quite affordable.
Because even if you are going to Elewe, you will still pay.
But they believe
And at
that
the end
is
of
cheaper.
the day, you still pay almost the same thing if you go to Elewe. So I think it's better.
It's better.
It's better
And safer.
and safer. And if you look at it in the long run, more economical to register in an hospital.
Well, now let's talk about some of the do's and the don'ts, right, for pregnant women. There are women out there listening right now, and some people do some things, and then you just wonder, you should not be doing this. You're pregnant. And some, they don't do some things. You ask them, why can't you eat this? Why can't you take this? They tell you, no, it's because I'm pregnant. In our house, they say we should not do this. In fact, the doctor said that we should not do this. Can you help Nigerians know some of the things, some healthy tips for mothers out there, pregnant women, some of the things they should be doing while they are pregnant, the things they should stop doing while they are pregnant?
Okay. So during pregnancy, one of the most important things to take is your routine medications. And that's because whatever blood or nutrients the mother has, she's now sharing it with
the baby
or babies, as the case may be.
True.
So
True.
she needs to make sure her store is replenished so that she has enough to share. So she needs to take her medications, that's her routine antenatal medications, as prescribed. And she needs to eat healthy, eat well, take lots of fruits, lots of vegetables, lots of protein. If you come for antenatal in a government hospital, they will tell you things like any food that begins with ẹyin, egg, ẹ̀dọ̀, ẹ̀fọ́, ẹja, ẹran. So meat, fish, eggs, chicken, lots of vegetables. At least in every meal, you should have a portion of vegetables in your food.
In every meal.
In every meal. Then take lots of water. Stay well hydrated. Okay? Also, you should try to stay away from too much sugar. So it shouldn't be, I want to take a drink in the morning, take another one in the afternoon, take another one in the night.
And we see some of them do these things.
Yes. Then also, you're not eating for 2 or eating for 3. You're eating a normal meal. Because we see a lot of pregnant women that say, well, I'm eating for 2. You see their plate, you'll be wondering, like, is one human being going to finish this?
They don't do this for me and my baby.
Exactly. So you don't need to eat for 2. You just need to eat enough to sustain you. Then don't. No alcohol during pregnancy. No smoking during pregnancy. It's better for you to, even secondhand smoking. So that is, if you have someone smoking around you, it's better to stay away from such a person. Herbal concussions is another thing that is very important to stay away from. Stay away from herbal concussions because we don't know what is in it. We don't know the quantity or whatever the constituent is.
True.
So we can't tell you, okay, this is safe, this is not safe for your baby.
It has no precise dosage.
Exactly, no precise dosage. So it's better to stay away from herbal concussions as well.
Let's talk about the man now, right? Most of all of these talks has been to the women. Right now, let's talk about the man. You have rightly said that the man also has a role to play, including the entire family. But many times we see that the men are just lost, right? Sometimes they do not even know what to do. I, for one, have witnessed a child delivery that they did not even know they are supposed to get a baby bag, or what they call that thing, where we will even still talk about that. Now, what's the role of the man in the picture, right? Your wife is pregnant, she's heavy. What are some of the things he should be doing, right, to help things come out Rosie?
Okay, so support.
Support.
Very important. Support, spousal support in pregnancy. So we expect the husband to carry the pregnancy along with the wife. Okay, so he should be as pregnant as his wife. So along every stage, the man also should know what is expected of his wife so that he can support her. It's difficult. It's already difficult enough that you're carrying another human being. So it's advisable for men to follow their wives for antenatal so they too understand what the wife is going through and how they can come in. So it's not just about you providing money. Yes, it's very important, but that's not your only role as a husband. Yes, there's more. You should know the signs of labor. You should know what is expected, what is not expected, because those lectures that they listen to in antenatal, the husband too should know, so that when he sees any of these signs, like,
is it okay for a man to attend antenatal with a wife?
It's advisable.
Oh, wow.
It's advisable so that he too understands what's going on with his wife, what's going on with his baby. When it comes to delivery, mode of delivery too, he's carried along. He knows everything that is going on. So it's not like, my husband will say no. My husband said I cannot do CS. When he hears it from the horse's mouth, it's easier for him to agree than when he just hears it from his wife alone. So that support must be there. Remind her to take her supplements, provide good food for her to eat. Not when she says, they say I should eat meat, you would say it's only meat, it's only fish. He understands the reason why
you're saying
she needs all these things as well. So
thank you very much for your conversation ever since you joined us in the studio here. There's something that usually happens, even if not all the time, but we know it happens. It has to be with blood donation. Right, when a woman is about to put to bed or has put to bed, we hear of cases of, she's short of blood, she will need blood. Can we talk about that process? What happens? At what point would a woman be needing blood? And how does it work? Is it a thing that you can just buy any pint of blood at the hospital, or the man will have to donate? Maybe I should ask first, pardon me, does it usually happen that pregnant women would have to need the blood? And why does it happen that way?
So one of the ways we prepare for birth is by blood donation. So for us, we ensure that all our pregnant women have blood donated and saved in the laboratory for delivery. And that's because one of the common complications of childbirth is bleeding. So we don't want to wait till the woman starts bleeding and needs blood before we start running around for where to get blood. So we make sure that their husbands or anybody has donated blood down for them is saved. So just in case they eventually need that blood at delivery, it's available for them.
So the processing of the blood delivery will be before the delivery, and this happens to all pregnant women?
All pregnant women.
All pregnant women. Beautiful. Now let's talk about the women themselves. Now we've talked about the men to some extent. Now for pregnant women, there is this other part of, this is how mommy A does a thing. This is how mommy A puts to bed. And what I'm doing right now is mommy A that asked me to do it. What's your take? What will be your statement to women who prefers to, listen to experience, because they believe that the experience of my mother-in-law, sometimes mother-in-law, neighbors and all that, is it okay for a pregnant woman to go through the route of a mother-in-law, a neighbor and all of that? Or you would say, let's address every issue differently?
Okay, so like I said, every pregnancy is a new experience. You cannot even compare two pregnancies carried by the same woman, not talk of a pregnancy carried by somebody else. So it's better for you to face your own pregnancy the way it is.
Face your pregnancy the way it is.
Whatever worked for A may not necessarily work for you. So why not just go on your journey the way yours is? It's a new experience, a different experience. So face your journey. Yes, you may listen to, depending on the advice, take your vitamins, eat well, basic advice. But when it becomes more complex, comes to more complex things, like let's say a hypertensive woman, you tell her to take her medication, she says no, Lagbaja did not use medications during her own pregnancy, so I'm not going to use, and nothing happened to her. She may not have been hypertensive. True. And even if she was, she may have been lucky to have scaled through. You may not be that lucky. So why not just prevent whatever complication can ensue and do what you're asked to do?
I want you to talk to the men out there. I want you to talk to fathers as regards what they should be looking out for on that big day, right? Sometimes some men get scared, they get worried, they don't even know what next to do. What are some of the signs on the day of delivery, the commonest one anybody will easily say, wake up a man from the bed now, you will hear him say, oh, when the bag burst, I'll be wanting. That's the one what should the man be looking out for? And then he should know that, oh, maybe tomorrow, or I think it's about that time. Can you take us through that experience of how it looks like for men and what they should prepare for?
Okay, so we have signs of labor, very common signs of labor. One of the most commonest signs of labor is contractions. So contractions are severe abdominal pain that waxes and wanes. It's probably the worst pain anybody can ever feel. And that's one sign that usually gets the men agitated. Like, my wife is in pain. Like, it's the normal process of giving birth. So yes, abdominal pain, that's stomach pain. Number two, the woman can see water. Okay, she can find fluid draining out of her vagina. That's another sign of labor. Then there's something we call show, which is mucus with blood. Okay, so you may notice that the woman is discharging more than normal, and then her discharge is mixed with a little bit of blood. Not just pure blood coming out. It's mucus mixed with blood. So those are the three commonest signs of labor.
So to the men out there, you've heard that one from our doctor guest this morning. You should always look out for these things, and don't forget, you always have to be right by our side. It has gone beyond just I've made money available, the money is there for you, so what else do you need me for? And you also heard from the doctor that you can also be part of antenatal. I think I like that part. I hope that someday, although I've not seen a man sit in a hospital before, maybe I've not been on the lookout, but then it's good for a man to be there during antenatals too. Now let's talk about, we have about 10-15 more minutes before we wrap it up for today. Let's talk about the heavy sides of the conversation. Now, talking about the heavy sides, I want to talk about some reactions, but let's take this call. Hello to you. Mr. Larry, good morning, sir.
Good morning, sir.
Yes, please go ahead.
Observation and some questions. Number one question is this. Some of us that are men, that are husbands, we want to be a good husband. Now, on the day of delivery, number one, I know general hospital will not even allow you. Why don't you allow we that are fathers to be part of you in the delivery section? As in when the woman is put into bed. Sometimes when they are at that stage, they pursue some of us as to excuse them to do their work. But we want to feel this pain as in to be there with them. I've experienced it with two children that I had at GH, that they have to pursue me or that you can't stay with us. So that's my number one question. Then number two question is this. I know I'm just tuning in. I don't know if our guest touched line. In the first pregnancy for somebody that just had a pregnancy.
Yes, sir.
Is it right for the husband, or is it right for her to be having sex with the husband towards like the early stage of the pregnancy? Those are my two questions.
Thank you very much, Mr. Larry. It's good to hear from you. Still with your radio, doctor will attend to you. Now, he asked two questions. I don't know if those questions are clear. Please do justice.
Okay, so for your first question, you're asking that why can't men stay in the labor room with their wives?
Yes, that you always chase them out.
Okay, so because of the structure of our own labor room in general hospital is a general labor room. Okay, so to ensure privacy of every other woman, that's why we don't allow men inside our labor room. But we have a special room that we call the birthing suite.
Okay.
That is like a private labor room. So if the husband wants to be there to experience the whole thing, he's free. So it's a special package. You can always request for that whenever your wife is in labor. Okay,
so somebody for General Hospital here, if you're listening, she's saying now that if you want a special package, where we've seen videos online where the man
exactly.
So maybe someone like Mr. Larry also wants to be there to do videos and all of that. There is something like that,
yes,
but it's called the special package.
It's birthing suit.
The birthing suit, which
yes.
is paid for.
Yes.
Then the second question, he's talking about sex while the woman is pregnant at the early stage. How safe is it?
Okay, so if there is no problem with that pregnancy, there's no complications in that pregnancy, there's definitely nothing wrong with sexual intercourse during pregnancy.
Okay.
Except the doctor says, for so and so reason, please stay away from sex for now. Otherwise, it's safe.
Otherwise, it's safe. That he stole that question out. I wanted to ask that, when a woman is heavy, is it even okay? Because we've heard of some who say, that is the best time you should do sex with your wife so as to have easy delivery. Is that a fallacious statement, or you agree to that as a doctor?
Okay, so yes, sexual intercourse in the late stages of pregnancy can help the woman during labor
Mm.
or delivery. Not to lubricate the place, as people say, but
That's that's the perfect word, to
okay, so
lubricate.
not to lubricate, but because it's like a form of exercise,
Mm.
it tends to help the woman to fall into labor naturally.
Some women will tell you it's by force, so you must do it. They say that's what you
So I've seen women that just after sexual intercourse they fall into labor. So yes, it's
Let's talk about some common myths, some conceptions, and then we will probably wrap it up with stigmatization that occurs mostly for women who go through the cesarean section, the CS. Let's talk about some myths. You as a professional, what are some common myths that you've heard, you've seen, that you would like to orientate the audience with?
okay. So one is, the major myth is around cesarean sections.
Okay.
If you have a cesarean section, that you're less of a woman. It's a fallacy. As long as you have a live baby and a live mother, whichever route the baby passes through is of no importance. Because at the end of the day, what's the point of, I must have a vaginal delivery and then the baby dies? Or I must have a vaginal delivery and the mother dies? What's the essence of that 9 months? So what is important is live baby, live mother. They should stop doing for beg by be
lazy woman.
You're not an ewure, you're a human being. So if you need the knife to be able to deliver, then so be it. No, but at the end of the day, it's not written on your forehead that you had a cesarean section. It's until you open your mouth to tell anybody before they will know. There's no difference between you that had a cesarean section and the person that had a vaginal delivery. We're both carrying our babies.
Can I place you on the spot, please?
Okay.
How safe is cesarean section? If you're going to be sincere, you're rating it over 10. Many a times we hear of, this person went through cesarean section and from there she passed. How safe is CS?
It's very, very safe.
Rate over 10.
8 over 10.
Rate it over 10.
8 over 10.
Nigerians can hear you.
8 over 10.
You're saying that to Nigerians?
I can say that.
CS is as safe as 8 over 10.
As safe as can be. If you go to a skilled center where they know the proper steps to take to perform the cesarean, very safe. Of course, I won't say there are no complications. Yes, there can be complications. Just like in normal delivery, there can be complications.
True, there are complications with normal delivery too.
So yes, there can be complications, but there are more successful cesarean sections than unsuccessful ones.
We have a message here from WhatsApp, and this person is talking about a tear during childbirth. Take us through tear during childbirth. This person wants to know, why do they have tear during childbirth? Is it a fault of the doctors or a fault from the mother? What happens? Why do we have tears?
Okay, so
I don't know if that question is clear. What is tear?
Okay, so because the passage where the baby is passing, that's the vagina, is very narrow.
Okay.
At times, we need to create more space for the baby to pass.
And that's the CS?
No. Even in a vaginal delivery. Okay, the vagina may be too narrow for the baby to be able to pass through. So we just give a cut to expand the place so that the baby can have space to move out.
Okay, the tear is tear like tear it.
Cut.
Oh, okay.
Although some women tear naturally. Just as a way to create space for that baby to pass out. But then the tear is repaired. Immediately the baby is out, placenta is out, then we repair and then it's as back as new. So
the last message here is with the duration. This talks about duration. What's the ideal time to stay in the hospital after childbirth? Some could do 2 weeks. In fact, some could leave the day after and all of that. Ideally, how long should a woman stay in the hospital after she have a baby? But let's still talk to Mr. Larry. Hello, Mr. Larry.
I don't know how you're going to help us, because there's a case of a woman that went for delivery around an hospital around the JD. And from there, the woman passed away due to negligence from that same place. I don't want to mention name. Due to negligence from that very particular place. Now, as an individual, as a layman, as somebody that doesn't know what is right and what is wrong, I might just be like, yes, my wife is about to put to bed. I'm register her in any office, in any hospital. And on the day of delivery, emergency can come and I'll just be like, okay, the hospital is hospital. At least they write it hospital. And I hang fast. Not knowing full well that they don't have the equipment or they have the means to do either CS or to do normal delivery. I don't know how we sensitize I don't want to use the word people that are not well educated, people that doesn't know what they ought to do. I don't know how our sensitization should be, or more. I don't know. It's just a suggestion. Maybe we have to put this thing more and more for people to know that yes, this particular hospital can do. Specialists, they have specialists, they have every other thing that you can. For GH, for example, I can vouch for that, and I know them. I've been to that mother and child ward. I follow my friend's wife to do antenatal when my friend is not around, so I know everything about them, even when they deliver and where they put them. But for people that don't know, man, I don't know how we can find the public on this. That's just my other observation. Thank you very much.
Mr. Larry there is saying that sensitization, and if you ask me before you even see anything, sensitization is what we're doing right now too. And it's good that you have said General Hospital is tested and trusted. But he has a very good point there. We have clinics, we have hospitals that are not well trained, and because of their nonchalant attitude or their lack of professionalism, lives are being lost, either the life of the baby or even the mother, or sometimes both lives. What do you think could be done to that? Maybe the Lagos State government, do you think the Lagos State government is doing well enough in order to ensure that the awareness is going round as regards sensitization?
Okay, so basically, yes, it's majorly the work of the government. Okay, they're supposed to do periodic checks on health facilities. We have HEFAMA. I can't remember what the full meaning is, but they're the ones that put hospitals in check. Most times, if you look at private hospitals, even general hospitals, you see HEFAMA approved. Okay, so if a hospital is HEFAMA approved, you want to assume that okay, they have what it takes to be able to take care of human lives. So that's one little thing that you can check for if you are not sure. For me, if you are not sure of how good an hospital is, please either walk into a health center or into a general hospital. We have health centers everywhere.
True.
If the health center cannot attend to you, they will tell you, please go to general
hospital.
Okay,
True.
we have general hospitals to everywhere. We have one in Ikorodu alone. We have 4.
True.
We have Ikorodu General Hospital. We have Ijede General Hospital. We have Imota General Hospital. We have Agbowa General Hospital. So you can walk into any of them at any time of the day. 247, you meet a doctor, at least a doctor and a nurse on duty, even though they are usually more than that. So it's, for me, I feel it's just safer.
I don't want you to go because I'm enjoying the conversation with you, but I know you have to go back. You have a lot right in front of your table. Let me throw this last one to you. You know, when we talk about birth preparedness, we've talked about the before, we've talked about the during, and then the after. Many a times what we just see is, oh, she has put to bed, congratulations, like you said, Ekwe Womo, and then they carry the baby and go. 7 days after naming ceremony. What should be done after a child is being born? Is that the end of the whole thing, or are there still some things that the mother needs to do or the parents? What should be done after the child has been born?
Okay, so pregnancy ends after the child has been born, but the journey doesn't end there. For us, we have what we call puerperium, and that's the period between when a child is born till 42 days after. 6 weeks later.
6 weeks?
6 weeks.
So she still needs to come to the hospital for 6 weeks?
Exactly. So up until 6 weeks after delivery, they are still within that pregnancy, childbirth duration. That's why Yoruba celebrate 41 days. So everything has a meaning. Okay, so you still need to come to the hospital. You get routine postnatal clinic checks. Come to the hospital, they still check on you, check the baby, check the blood pressure, everything about the mother, even the baby. For us at General Hospital, one of the commonest complications in the newborn period is jaundice.
Jaundice, yes.
So we are always screaming about jaundice. If you give birth before your baby goes home, they will check for jaundice. They tell you come 72 hours after delivery again for routine jaundice check, just so that we are sure that the baby doesn't have, because it's one of the commonest killers of newborns. So we check for jaundice, we counsel about breastfeeding and all that. So pregnancy is not yet over till 6 weeks after delivery.
42 days.
42 days.
We want to thank you very much, Dr. Moji Moni. I hope I got that correctly. It's been an amazing time with you in the studio here. But before you go, the last question will be as regards stigmatization, especially in line with the Cesarean Section, the CS. How best can you orientate the mindset of Nigerians listening to you at a time like this, that CS is not a suicide mission, CS is not a lazy woman's thing? what are those words you have to say to Nigerians as regards CS and the stigma that comes with it? A lot of stigmas comes with
Yes,
CS.
I agree. So, cesarean section, that is CS, is not a lazy woman's job. It's not easy even going through a cesarean section. Not like a vaginal delivery. Once you deliver your baby, you're up on your feet. But then it's more difficult when you have a cesarean section. So it's not a death sentence. It's just to be sure that we have a live baby and a live mother. So please, let's make the 9 months worth the journey. And let's not make mistakes at the last minute. If any woman needs a cesarean section, please let her go for it, if recommended by her doctor or by her own choice. Please let her go ahead. She's not a lazy woman. It's not easy to carry a baby for 9 months. It's not easy to deliver the baby, irrespective of the means.
Thank you very much. Questions keep coming. That's why I say I don't want you to go. Let this be the last. Let this be the last question for mothers that are out there, maybe the pregnant ones, and they've heard everything we've talked about today, and they feel like, oh, I love that doctor, the way she spoke. I'm going to go to General Hospital. What's the process like for a woman who is pregnant and then wants to subscribe to General Hospital? How does it work with you guys?
Okay, so thankfully today is Thursday.
Yes.
We do our antenatal registration on Thursdays. Every Thursday.
Wow.
You can walk into the hospital in the morning and then come to register for antenatal. So when you come on Thursdays, they will explain the whole process, things you need to do, your test, your blood donation, and all that. Everything will be explained that day. Then you will be given another date for booking. So that will be on a Tuesday. So you'll be properly booked, your investigations will be looked through and all that. Then you now start antenatal proper.
But Thursdays like these?
Thursdays like this.
From what time to what time?
I think they start by 8 a.m.
8 a.m.
Yes.
Okay. This is how far we can have it on the show today. Special thanks to General Hospital Ikorodu. Special thanks to the medical director, the man I call my father. Of course, he has transformed General Hospital so well. Dr. Taiwo Azan. Prince, Dr. Taiwo Azan, let's not take out the Prince from his name. And of course, special thanks to our doctor too, who has joined us this morning. Thank you very much for doing justice to the conversation.
Thanks for having me.
Right now, I'm feeling like I'm so prepared for pregnancy. Unfortunately, I'm a man. Because I feel I know everything already. So thanks to you. My name is Okpeyemi Adebambo. Until next week, Thursday, same time, same station. Remember, health is wealth. Stay safe, stay healthy. God bless Nigeria. God bless Lagos. God bless General Hospital Ikorodu.